let's move on to writing a nursing care plan. We want to write a nursing care plan. We've talked about a nursing care plan for lots of times. You've heard of it. We've done some before. We've seen it. We've seen the sheet and all that. So to write our nursing care plan, don't forget, I already said that we have 3 sections. So we start from the first section, that is the cover page or the front page. Now this section of the front page has all about the patient on it. Okay, every information about the patient is expected to be on the front page. Of course, every important information, not all the unnecessary informations. So we have patient details like his name, his age, gender, patient folder, the ward and the diagnosis, the physician taking care of him, basic information about the patient. And then after that, right below it, we have our patient problems. In most of the nursing training institutions in Ghana here, we are expected to have 4 problems for the patient. Don't forget, in identifying your problem, always make sure you prioritize them. Okay? So you don't start writing the patient's problems right after they start talking. You have to take your time. Don't start writing the moment they start talking. Take your time. They might talk about some 5 minutes before they actually get to their current problems. So relax. Take your time, listen to all their problems. If you have a small sheet around, you can write them, you can jot them on it before you transfer them onto your nursing care plan, so that you can get time to evaluate them and prioritize them. When once you are done, then the next thing that is on the care plan sheet is the patient's allergies. Does the patient have an allergy? Is he allergic to something? Is there something that when he takes in that can affect him? We take this information because most medications that we give can have serious allergic reactions like Steven Johnson's on patients. So knowing the allergic reactions will also help us in knowing what medications and even what procedures to put on them. Alright, so it's very important. Don't always be writing no allergy discovered or no allergy found or no allergies. Sometimes you have to take your time and ask them. Some people know the allergies, but sadly most people don't even know what they're allergic to. So it always has to normally end with no allergies recorded. And then after that, you come to your patient's strengths. Now these strengths are the problems that you've identified. So what can the patient do to help him or herself in dealing with the problem that you and the patient has identified? We talked about that under the nursing diagnosis too, so we won't waste our time there. But one important thing is to always remember that the patient's strength must correspond with the problems. So first problem must go with the first strength, second problem go with the second strength, in that order. And then when you are done, the last part of the front page or the cover page is the routine care. What the patient does regularly, what you do for the patient regularly: oral hygiene, bathing, intake and output, urine testing, temperature, the vital signs and all that. Those are routine care that we do for all patients. And so the first section deals with that also. If you are done with that, then we can move on to the next section, that is the care plan sheet itself. So the first section is assessment and then data collection, because it is through this assessment that you're going to get all the information that you have on the front page. Okay, so data collection and assessment is very important. Your nursing problems or the patient problems will be identified through assessment and data collection. The strength too, the same thing. The patient details, the same thing. So assessment and data collection is the first step in writing your nursing care plan, and that forms part of the front page or the cover page. Now the next step in writing your nursing care plan is the data analysis and organization. Yes, that also deals with the first or the front page or the first section. You have to organize your data. Like I said, your problems must be prioritized, it must be arranged, it must go with the patient's strength also. So that is prioritization, and that basically is organizing your data and then analyzing them. Okay, so that is the second step in writing your nursing care plan. And then your third step is what we treated in the first lesson that we had, and that step is formulating your nursing diagnosis. It is a whole broad topic, so we took our time and we treated that. If this is your first time and this is your first video that you are actually meeting, you can go check on our page, the Nursing Student channel. We have a playlist of nursing diagnosis. Everything that you need to know about the nursing diagnosis is there, so that you can get some understanding before you proceed on with the next steps. The fourth step in writing your nursing care plan is setting priorities. We talked about that one too in the nursing diagnosis, but here we're going to talk about it again because we're going to focus on something else. In the nursing diagnosis, we focused on the vital signs and the ABC in prioritizing your nursing diagnosis or your problems and strengths. Now, in the nursing care plan, we're also going to talk about using the Maslow's Hierarchy of Needs. Don't forget, the nursing care plan is focusing on giving you the care, unlike the nursing diagnosis that focuses on arranging the problems and the strengths. Okay, so now we're going to care for you. So apart from the ABC and then the vital signs, Maslow's Hierarchy of Needs is very important. What does the patient need at this very moment? So knowing the Maslow's Hierarchy of Needs, you know that we always have to have a basic or physiological needs first, and then we can go on to our safety and security needs. We can move on to our love and belonging needs. We can proceed on to self-esteem needs, and then self-actualization needs. These 5 needs is what we focus on in prioritizing our care. Okay, they are what we focus on in prioritizing our care. That is the care that we give to the patients. The basic needs, as we all know, of physiological needs basically deal with the patient's nutrition, his elimination, his airway, his circulation, his blood pressure. We have sleep, shelter, exercise, sex, and all that. They all form part of the basic needs of man. Okay, so even it comprises of the ABC also, because we have airway, we have circulation, we have breathing, we have the vital signs in it as well, we have nutrition and all that. They're all basic needs that we focus on when it comes to giving care. The next step in the Maslow Hierarchy of Needs is the safety and security. We are talking about preventing injury and ensuring a safe environment. That is a safe environment in the sense that we can have financial security, we can have employment, we can have protecting your properties, insurance, and we can use side rails. We can ensure that the floor is dry, not wet or slippery. We can talk about hand hygiene. We can isolate patients that have communicable diseases from the general patients. We can talk about suicide precautions, not leaving sharp objects beside the patient and all that. And then the third one, that is love and belonging, we can talk about including the patient relative in the care. Patient must have his relatives around them to give them support. They must have people that they love or care about around them to, give them some, encourage them, to give them some courage, to give them some hope. All right. And then we can also talk about self-esteem needs, whereby we encourage the patients in being accepted in the community. We talk about prejudice, we talk about discrimination and all that. Okay. And then the last one, that is the self-actualization needs. We can talk about spiritual growth, can talk about ability to recognize and the point of view of others. That is, they should accept others, they should accept what people are saying, they should be able to empower themselves, and you should also encourage them to be self-sufficient or to accept themselves. Now, this prioritization also helps us in delivering holistic care, as stated in the first video, to the patient, because we get to know all other aspects of the patient and then all that we can put into the patient's care to help the patient back to optimum health. And then the fifth step in writing your nursing diagnosis, we have establishing client goals and then the desired outcomes. Yes, I said that we talk about the goals further when we get here. Yes, the goals and the desired outcomes must be established. How do you establish your goals and your desired outcomes? Now you have assigned priorities to your nursing diagnosis. You have arranged them in such a way that you can handle important or emergent situations first before you move on to the less important ones. Alright? Now, the goals or the desired outcomes will describe what you, the nurse, hopes to achieve. by implementing the nursing intervention that you have planned for the patient. Alright? Yes, so it is these goals that we are going to also evaluate. Alright? It is these goals that you're also going to evaluate. So your objective outcome criteria is also important here. Now, to establish your goals, know that it is through these goals that you're going to be able to know the patient's progress with the healthcare. Okay, you're through these goals you're going to be able to know your patient's progress with healthcare. So your goals must always follow the SMART method. And what is the SMART method? The SMART method basically deals with your goals being specific, being measurable or meaningful, being attainable or action-oriented, being realistic or results-oriented, and lastly, being time-bound or timely oriented. That is why I said that time is very important in your nursing care plan, because your goals must always follow the SMART rule. And the SMART rule says that your goal should be specific. That is, you should know what you are handling. If it is acute pain that you're handling, be specific. Touch on the acute pain. Don't just roll around your goal. Okay, don't be roaming about your actual patient problem, beating around the bush, doing things that won't handle the actual problem. Patient has pain, so let's deal with pain. Stop talking about nutrition when you're talking about pain. Right now the patient is in pain. The diet will come later. So for now, let's focus on the pain. That is being specific. Don't roll around the problem. Don't be general around the problem. We have general care that we give to the patient, but when it comes to an actual problem or an existing problem or even a risk, focus on the problem. And that is, make sure your nursing care plan or your goals are specific. And then your goals must be measurable. Alright? Making sure that your goal is measurable simply makes it easier, very easy, for you to monitor the progress of the care. So if your goal, you're saying that let's use the pain. Patient's pain is within a range of from 0 to 10. The patient has a scale of 8, a value of 8. So your goal should be measurable in such a way that you want to ensure that by 4 to 6 hours, the patient's pain will subside from that 8 to, let's say, 4 or 3. Alright? Don't just say that patient's pain will subside, let's say, in 3 hours. What if it subsides from 8 to 7? It has subsided. Is that what you wanted? No, maybe you want lesser. So once you make your goal measurable or meaningful, you also help yourself to be able to focus and make it easier in order to track the progress of your care. And then again, your goals should be attainable or action-oriented. Yes, make your goals flexible. Don't be too rigid. Don't give too high expectations. You can't expect a patient to have a pain of, let's say, on a scale of 10, 8, and then within 30 minutes you want to have your patient's pain subsiding from 10 all the way to, let's say, 2. No, that is not attainable. That is not action oriented. We want to subside the pain to, let's say, 4. So we give them enough ample time. Let's make sure that our goal is attainable. Don't just set the goals. Make sure that you can achieve them. Okay, make sure that your goals can be achieved. And then the next one, make sure your goals are realistic or results oriented. Yes, it is very important to look forward to effective and successful outcomes by keeping in mind that the available resources in hand and what you have to achieve those goals. So you are at a health center, you don't have a surgical unit, you don't even have an operating theater, and the patient comes to you and you set a goal for surgery for the patient. Meanwhile, you're not planning to transfer the patient early or within the shortest possible time. That is an unrealistic goal that you've set. How will you achieve that goal when you don't even have a surgical team, you don't have an operating theater, you don't have a surgeon? Simply, that is impossible. So your goals must be realistic or results oriented. And then the last one is your goals must be time bound. Yes, you can't say that patient's pain will subside. When? At what time? What day? Give us time. Give us a day. Give us a specific duration that you want to achieve your goal. And it is only through that way that you're going to be able to assess whether your goal was achieved or it wasn't achieved. to give us a time frame or a time orientation. So let's say within 3 hours, within 2 hours, within an hour, at this time, at that time, on this day, so that we can actually orient your care or your goal into a specific time frame.